Welcome to the CHC podcast. I'm your host, Julie Fisk. Today I'm here with Jon Pruitt, Senior Vice President of CHC Supply Trust. Today we're going to talk about supply chain resilience and how it applies to rural and community hospitals today. So Jon, we often hear about resilience when it comes to healthcare supply chains. What does supply resilience mean for hospitals today?
Supply chain resilience for healthcare is even more critical today than ever before. Before COVID, folks realized that, supply chain is something people do, but really didn't fully understand what supply chain is. After COVID, supply chain took on a whole different meaning, and when people respond to what you do, you're like, holy cow, that's really crazy, significant, and a tough challenge. The healthcare resiliency is more important today because you have to anticipate disruption. The disruption today is not limited to PPE like it was during COVID. It's pretty much everything under the sun. Anything and everything that can go wrong will likely go wrong, and you have to anticipate for that. You have to prepare, have a plan for disruption. Also be able to respond when it actually does happen. How do you act? What are the plans in place to be able to respond accordingly? And then once you actually respond, how do you recover from that disruption? So it's a very comprehensive approach to maintaining effective supply chain resiliency. And you do this while maintaining your day job and maintaining this effective supply chain of the normal goods, supplies, equipment, and service to your caregivers so they're providing appropriate patient care.
Wow, that's a really full plate.
Absolutely, it sure is.
So what can hospitals do on a daily basis to have a more resilient supply chain?
Well, first and foremost, you need to treat supply chain disruption and resilience like you would prepare for a disaster. So if you're a Gulf state, you're preparing for hurricane preparedness every day, whether it's hurricane season or not. You're doing drills, you have policies and procedures in place, you have desktop or tabletop reviews with your clinical team, your staff. You're preparing for disaster. I would argue that supply chain disruption, supply chain resiliency is not just a one-time event. It's not a project. It's simply something that you have to have ultimately the operational discipline to be able to react accordingly. So how you would do that is, again, putting together policies and procedures. Develop a core list of items that you simply can't run out of. Maybe that's your top 200 items that are critical. Identify that, then find alternatives, whether you have clinical equivalent substitutes as your primary and secondary alternatives to your products, so that when that disruption does occur, you have a backup plan that's been tested, it's been evaluated, the clinicians have been trained on it. You don't want the first time that you have a disruption that for example, a brand new IV catheter shows up in the hands of a nurse and they haven't been trained on that. So you have to ultimately be prepared, have policies and procedures, develop a core list, also diversify your supply chain. So what that means is ultimately not put all your eggs in one basket. From a sole sourcing perspective, that means a single vendor. You need to have a backup plan. If that sole source contracted supplier has a backup, what is that? What is that equivalent substitute that could be available? Have a secondary distributor, not just one supplier for the products, but have alternatives. Have that all be in your comprehensive plan. Also work effectively with a clinical value analysis team. That's going to be critical. Have that clinical value analysis team be more strategic, not just simply a product standards committee evaluating new product introduction, but be proactive and have that core group be reflected in their charter that supply chain disruption, supply chain resiliency is a part of that charter. Make that part of their mission on being able to react accordingly to disruption and have a plan, so that when that happens, you've been able to orchestrate drills. You've been able to have that product, whether it's actually out of stock or not, have the team be able to use that on patients so that when the actual disruption occurs, you've used the product before, it's been evaluated. You have the alternatives built into your item master so that you have truly the whole plan be ready to be executed, and it's not simply a whack-a-mole type of a fire drill, that you have an orchestrated plan for resilience.
It's almost like predicting the future. How are you planning for something when you have no idea what's coming?
You have to anticipate, right? So here's an example of anticipating. So right now we're in a conflict in Iran. So as soon as the potential for disruption occurred, when we had military presence in that region, as a supply chain leader, you have to start thinking what could be impacted in that area of the world. We're having to now react to that to say, hey, we have products that are on allocations, right? So it was 125% allocation on certain supplies last week. This week's we're at 100%. Next week, if it continues, it could go down to 75% of allocation. So by being able to anticipate based on current world events, you can be prepared, you can be responsive, you can have backup supply, you can have redundant supply, but you have to plan for that disruption so that when that anticipation occurs, you have a process to implement.
On that note, how does geography play into sourcing?
No, that's a great question. Geography absolutely has an impact, right? So if, today that conflict's in that region in the Middle East, well, China is impacted by that. They have a lot of oil pressure, plastics are impacted. So geography does play a region. During the pandemic, a lot of our supplies, pharmaceuticals came from China, still does, right? So you have to identify maybe near shore sourcing options, domestic produced products. You ultimately have to absorb some of that higher cost with alternatives, but it's better than having an out-of-stock process or an out-of-stock situation that could impact patient care in a negative environment. So that's part of the plan, is that resiliency. You have to have alternatives, whether that's doing secondary contracting in that sole source environment, but geography does factor into that risk mitigation strategy. So you have to know where your products are coming from, where they're being manufactured, identify alternatives in different geography regions. So great question.
So how does operational discipline play into all of this?
Absolutely have to have operational discipline. It starts with having a policy and procedure so that the staff, your procurement team, your nursing clinical team knows how to react to supply chain disruption events. That's part of your healthcare supply chain resiliency policy and procedure. It's creating that discipline. Basically, another way to say it, they become battle tested because you planned, you've prepared, you've anticipated, you've responded to this, and it's all in a guideline that everybody knows how to operate when that disruption occurs. So that creates comfort. The nurses know what to do when this happens, when product A is no longer available. They already know what the approved product B is, or product C. The buyers know what to do because it's built in the system. Everyone's been trained. You've identified your core list of items, so it's just executing the plan. The more you practice, the better you're going to be at executing on that plan.
Well, there's a lot of working parts here. So I'm wondering, have you guys incorporated AI in any way? Because everybody's using it now to improve workflow.
Absolutely. AI is becoming more and more prevalent every day. In fact, I don't think there's a day that goes by that I don't hear something about AI probably 5 or 6 times a day. It's so prevalent. One example in healthcare, the use of AI, we probably have experienced personally, right? In a primary care physician appointment, you'll see a sign that says, hey, ambient listening is going on, you're being recorded, and that's to help the doctor transcribe the notes from your visit so that that person has more time to review the dictation versus actually dictating it. So that's one example of AI. We're seeing pharmacy companies now incorporating AI in drug formulation. So today, some therapies that are being used for certain patient conditions, they're using AI to say, hey, if it's effective for this condition, what if we tweak the formula for a different condition? What does that algorithm look like? And the AI is fast tracking a lot of research, so there's a lot of productivity going on in AI in the world of pharma. How does that impact supply chain? Well, AI can provide an early warning for supply chain. They can predict disruption based on your demand signal, what your utilization is today. That information goes to the distributor. Ultimately, that sales tracing information goes to the manufacturer and their raw materials, right? So it's an entire supply chain that could be supplemented by AI technology. You can also incorporate RFID technology and give you real-time sensing on critical items in your hospital, whether that's in your cath lab or operating room. You can incorporate that technology in your system to give you insight on supply chain shortages before they actually occur. Distributors are also a key way to help. They're using AI today. So a lot of technology that's coming out that you don't necessarily have to break the bank, and we can talk about that more if you like.
We absolutely should talk more about that because we all know AI is expensive.
Oh, absolutely. And it doesn't have to be a scenario where you are an early adopter in supply chain AI technology where you go to buy something off the shelf. Today, your GPO partner, your group purchasing organization partner has that technology. It's simply asking, how can you gain access to that technology? How can I get visibility into what you're seeing? You're on the front line, so to speak, negotiating with the manufacturers each and every day. What are you seeing? How can I get that same level of insight that you're seeing? Share that information, whether that's in a daily, weekly report. How can I get access? They have it. They'll give it to you. You just have to ask. So that's one strategy to employ. Another one would be to engage your primary distributor. They're using AI today. In fact, our primary distributor has partnered with Microsoft and Copilot to have that visibility into their supply chain, into their manufacturing process, to be able to predict across the country where an out-of-stock situation is highly likely and predict that prior to that event happening. Have that insight be at your fingertips, at your facility, and your buyers to say, hey, it looks like we only have 2.5 weeks left of this supply. What do I need to do? Do I need to panic buy? That's not a good strategy. You should also have buffer stock on the front end on those critical core items, already have a surplus stock on your core list items. Secondly, that technology will identify a clinically equivalent substitute because they're already seeing hospitals using the alternative. It's based in the system, so you can see what's already approved based upon the volume of product on those alternative items. So that can help fast track some research that your team may have to do. Take that to your clinical value analysis team and say, hey, here's what's going on. This isn't on our core list, but guess what? It's about to be disruptive. Here's some alternatives. Here's the research that we've done based upon the insight of the AI tool, and which product should we go with, because these other products are readily available today, but once that primary item's out of stock, then these other ones could be impacted in a shortage. So it's, again, anticipating, being able to respond, be able to react, but it's all based upon a plan that's already been orchestrated. You're just now executing on it.
It sounds like supply chain resilience across the board is going to be costly. So are hospitals able to manage that, or are some difficult decisions being made?
Difficult decisions are being made. Ultimately, supply chain resilience is costly, but it's necessary. And we know that tariff pressures are happening, inflationary pressures are happening. What are you doing to try to mitigate that cost? The cost pressures to maintain an effective supply chain resilient organization with alternative products being sourced domestically, having backup plans. There's a cost associated with it. We did talk briefly about AI, but not breaking the bank. There's alternatives to try first with your GPO and distributor partners, but supply chain resiliency, I would also say financial resiliency supports supply chain resiliency. So that is critical. And what can you do? Rather than tackle 2 or 3 or 5 initiatives to try to reduce cost, how about looking at it more holistically and saying, hey, GPO partner, what have you done for me lately? When's the last time you evaluated that GPO, that group purchasing organization partnership? When's the last time you went to market? The Staples Easy button, the status quo doesn't work well in today's environment. A lot of organizations that have recently come on boarded to CHC Supply Trust, they've all come from our competitors. We're a channel partner of Health Trust. So I would say this to a Health Trust member, I would say it to a Vizient member, I would say it to a Premier member. When's the last time you went out to bid and tested the market? That would be a great opportunity for you to put in that RFP, and I'd recommend using a neutral third party to facilitate that GPO RFP. What's the criteria that you want, that you expect from a GPO partner to help you be more resilient in today's environment? What criteria do they need to meet? And then ultimately, what savings are you looking to achieve? That would be an awesome way to really impact your bottom line holistically across the globe on all products that you're using, not just 4 or 5 initiatives, but over 1,500 contracts could positively impact your bottom line. That is what a bold move would look like in today's environment to really help you financially.
So there's so much going on right now, but looking ahead 2 or 3 years, what can hospitals do to effectively manage all of this?
Yeah, absolutely. It's going to be in 2 to 3 years, you're going to be able to separate the winners and losers from who was successful from a supply chain resiliency plan and those that don't have one, right? So, ultimately, you have to have policies and procedures, put that in place so your team knows how to execute, right? Don't treat this as a fire drill. Treat it as a true disaster so that you have a plan, right? COVID was a disaster. Right? So ultimately, how does your organization prepare for a disaster? I would implicate or basically say that you need to have that same level of rigor and structure around supply chain resiliency built into your clinical value analysis process. That's critical. I would also say you need to be proactive in your partnerships, right? So that could be a scenario where are you aligned with the right GPO partner? Are they helping you in these times of crisis? Are they providing you information in real time to be able to respond to supply chain disruption? Are they helping you control your costs to be more financially resilient? What is your partner doing today? So we talked about briefly, CHC Supply Trust and our role in supporting rural and community hospitals. That's absolutely what we do. We act as that virtual integrated delivery network in support of all of our members to maintain effective supply chain resiliency, help them be more effective in their day-to-day operations and providing patient care, giving them insight into supply chain disruption, helping identify products that are maybe not readily available but are clinically acceptable. We have value analysis support, we have custom contracting support, and we provide cost savings. So all of that helps an organization, community, standalone, independent hospitals survive in today's environment.
I mean, that sounds like an awful lot. That's a lot of work that needs to be done. How could hospitals get started on that, like right now?
What I would do right now is first focus on, do you have a core list of items that your team knows they simply just can't run out of it because it's going to impact patient care? So is that core list 200? Is it 25? Is it 50? Do you have a core list? If you have a core list, have you done the next step to identify what are the secondary or tertiary items that you need to have either in stock or at least evaluated by your clinical value analysis team, have operationally roles and responsibilities defined in the charter of that clinical value analysis committee? What are the roles of that organization, the members on that committee? It's not just simply a product standards committee, it's truly a more strategic approach to maintaining supply chain resiliency. So reevaluate that charter for the clinical value analysis committee, identify the core list, make sure you have all of those items identified with the alternative approved substitute items. Make sure that those items are built in your system, that you have an item master number for it. You know where to get it. Do you have an alternative distributor, an alternative vendor? Do you already have an account set up with them? Have you trained on those items? If not, let's get that in front of the Clinical Value Analysis Committee, have that be part of an in-servicing with the vendors, but start simple with a core list, evaluate those items, get the alternative approved substitutes, impact and empower that clinical value analysis team. Make sure senior management is on board with that, right? So they have to be empowering you as the supply chain leader in your organization to be able to make a difference, not just stay in your silo and down in the basement, but truly expand so that you're impacting day-to-day operations. So those are just a couple of things to get started on day one.
Well, thank you so much, Jon, for joining us today. We have learned so much about supply chain resilience and how important it is.
Absolutely. Thank you, Julie. It's been my pleasure to be able to meet with you today and tell you a little bit about CHC Supply Trust and how we help support our members maintain that effective supply chain resiliency for their organizations.